Welcome to the Curious Scholarette, where research meets real life. Today's episode is titled, People in Africa Don't Struggle with Mental Health. The data says otherwise. Let's challenge one of the most dangerous misconceptions about mental health in Africa. In many African societies, mental health is still viewed through a distorted lens. The stigma surrounding mental health issues is deeply rooted in cultural beliefs and traditional practices. Many people in these communities rely on traditional healers and spiritual leaders for guidance, often attributing mental health problems to supernatural forces or spiritual imbalances. This perspective can lead to a lack of understanding and support for those suffering from mental health conditions. People often believe that unless someone is walking naked on the streets or violently out of control, they're not mentally ill. This misconception is harmful and prevents many individuals from seeking the help they need. Mental health issues can manifest in various ways, not all of which are immediately visible or dramatic. Anxiety, depression, and other mental health conditions can be just as debilitating as more overt symptoms, yet they often go unrecognized and untreated. Others claim depression is a Western problem, that Africans are too strong to experience what they call minor mental issues. This belief undermines the very real struggles that many people face. Depression, anxiety, and other mental health conditions do not discriminate based on geography or ethnicity. They are universal issues that can affect anyone, regardless of their background. By dismissing these conditions as Western problems, we ignore the suffering of countless individuals who need our support and understanding. But here's what science says. Research has shown that mental health conditions are prevalent across all cultures and societies. Studies conducted in various African countries have found significant rates of depression, anxiety, and other mental health disorders. These findings highlight the need for increased awareness, education, and resources to address mental health issues in African communities. By embracing a more scientific and compassionate approach, we can break down the stigma and provide better support for those in need. Mental health is a critical aspect of overall well-being, and it is time we start treating it with the importance it deserves. A 2023 meta-analysis published in Child and Adolescent Psychiatry and Mental Health examined 18 studies involving over 37,000 adolescents across Africa. This comprehensive review aimed to understand the mental health landscape among young people on the continent, shedding light on the prevalence and factors contributing to mental health issues. It found a mental health distress prevalence of 27.3%. indicating that more than 1 in 4 adolescents experience significant mental health challenges. This high prevalence underscores the urgent need for targeted interventions and support systems. The study also highlighted that older teens are the most affected demographic, with factors such as academic pressure, social dynamics, and transitional life stages contributing to their heightened vulnerability. Source: Abate et al. The findings call for a multifaceted approach to mental health care, involving schools, families, and healthcare providers to create a supportive environment for adolescents. The research emphasizes the importance of early detection and intervention, suggesting that schools and communities play a crucial role in identifying and addressing mental health issues early on. By fostering open communication and providing resources, we can help mitigate the impact of mental health distress on young people. Furthermore, the study advocates for increased investment in mental health services and training for healthcare workers to better support adolescents. By equipping professionals with the necessary skills and knowledge, we can ensure that young people receive the care and support they need to thrive. In conclusion, the meta-analysis by Abate et al. Provides a crucial insight into the mental health challenges faced by African adolescents. It calls for a collaborative effort to address these issues, ensuring a healthier and more supportive environment for the youth. Another review published by Nature revealed alarming rates among African youth: depression, 26.9%, anxiety, 29.8%, emotional and behavioral problems, PTSD, 21.5%, suicidal thoughts. Source: Brits 2021, Nature. In Uganda, a 2023 study found that 24.2% of adults live with some form of mental disorder, often without proper diagnosis or care. Source: Nature Mental Health, 2023. In South Africa, after the COVID-19 pandemic, the numbers remained high. 26.2% of adults showed signs of depression, and 17% reported anxiety, according to a national study in Frontiers in Public Health. Source: Frontiers, 2023. The Africa CDC estimates that over 116 million people on the continent were living with mental health conditions even before COVID-19. That's more than the entire population of Ethiopia. Source Africa CDC, 2023. So why are these issues invisible? Because of stigma, silence, and deeply rooted cultural beliefs. In many communities, mental illness is still blamed on curses, witchcraft, or weak faith. But change is happening. From Ghana to Kenya, a wave of transformation is sweeping across the continent. In the vibrant streets of Accra, the capital of Ghana, you can feel the pulse of progress. The same energy is palpable in Nairobi, Kenya, where innovation and tradition blend seamlessly. From Nigeria to South Africa, the story is the same. In the bustling markets of Lagos, Nigeria, and under the towering skyline of Johannesburg, South Africa, communities are coming together to address one of the most pressing issues of our time: mental health. Researchers, nurses, and mental health advocates are working tirelessly to destigmatize mental health, improve access to care, and educate the public. These dedicated professionals are conducting groundbreaking research, developing innovative treatments, and holding seminars to spread awareness. Community counseling sessions and mental health workshops are becoming more common, providing safe spaces for individuals to share their experiences and seek help. These initiatives are teaching people that mental illness is not a foreign disease, but a part of the human experience that can be managed with the right support. It is real, it is common, and it is treatable. Doctors are having heartfelt conversations with their patients, families are offering unwavering support, and healthcare workers are providing comfort and care. Together, they are building a future where mental health is understood, accepted, and treated with the compassion it deserves. So the next time someone says, Africans don't struggle with mental health, tell them, the data says otherwise. Let's normalize mental wellness in every African home, every school, and every hospital. Because mental health is health. Period. This was The Curious Scholarette. Hit the subscribe button for more and share this to reach your African friend or relative.